differences in how healthcare works in Austria versus in the US. Insurance in Austria is largely public, and we're going to talk about the different aspects of the healthcare system here. First, there are some pre-departure medical considerations to make. Talk to your doctor in the US about any needs you might have while abroad, including how to best cope with homesickness and culture shock, as well as how to manage your medication while away. Collect all your medical documents before you leave for Austria, both as physical and digital copies. Be sure your immunizations are up to date. See if you need any medical records stamped and signed by your physician. Look into if you need any documents translated, and schedule any checkups before you fly out. If you need specific medicine, bring enough with you into Austria for at least the beginning of your stay, and double check if the amount you're allowed to bring into Austria is limited. Keep in mind that shipping medication in Austria is illegal. When traveling to Austria, keep your medical records in your carry-on or your backpack to be sure you don't lose them. Previous USDAs have recommended bringing a supply of birth control, migraine and allergy meds, and a bottle of ibuprofen that will last you throughout the year. And once you get here, find a doctor to see about any prescriptions you might need after you arrive.
Let's talk about the B-File IAB, your public insurance as a USTA. You have medical coverage until the end of your USTA contract, as well as limited coverage 6 weeks after your contract ends. This includes treatment of illnesses and injuries, eye exams, basic dental care, pregnancy, medication, prescribed therapeutic and laboratory services, partial coverage of psychological treatment, and more. It doesn't include dangerous tours or mountain rescues. Contact the B-File AAB or look at the links in the healthcare section of the handbook for a full list of insurance benefits. The B-File AAB covers you in the EU, Switzerland, Liechtenstein, Norway, and Iceland, but not in the United States. If you bring dependents with you to Austria, there's some last information for you to know about. If you bring your children with you who are under 18 and still in school, they can be insured free of charge with your B-File AAB insurance. The same is true for spouses, as long as they're exclusively involved in childcare. In both cases, a birth certificate for each person and a copy of your Meldezettel must be provided to the B-File AAB.
Next, you can access Austrian healthcare with what's called an e-card. This is a green card that connects you to the healthcare system. You should receive your e-card and social security number through the mail after you sign your work contract, but you can still visit the doctor with your social security number in the meantime. Call the e-card service line or your local B-File AAB office to ask for your social security number by providing your name and birth date if you do not receive it in the mail. Once you get your e-card, always keep it with you. Check to see if there are any fields displaying stars on the backside. If this is the case, you'll need to request an Urlaubskrankenschein to be sure you're covered in case you get sick while you're traveling. You can do this online, but double check if you need any additional traveler's insurance if you're traveling outside of the EU.
Finding a doctor and making appointments will be the next part. Before going to an appointment, be sure that the office or hospital that you go to has a contract with the B-File AAB so that your services will be covered by your insurance. If you need to see a doctor, talk to your RAs and those around you to find one near where you live. There's links to a directory of doctors in the healthcare section of the handbook. You'll be billed for a small part of the deductible for outpatient treatment. Hospitalization is covered in full. You also have the option to schedule appointments with specialists yourself. Because you'll be a new patient in Austria, you might have to get a physical exam before you can get any prescriptions. There are some immunizations recommended in general and by past USTAs. These include immunizations against the flu and common cold, as well as against a tick-borne disease called TBE, tick-borne encephalitis. This one is especially recommended because TBE is similar to Lyme's disease and can sometimes result in meningitis.
You'll probably need to go to the pharmacy, called an Apotheke, at least once during your time here. There are also some differences between Austrian and American pharmacies that you'll experience. Most medications are available to you, but a big difference is that many require a doctor's prescription. While you can buy treatments for the cold and flu over the counter, other medications need a prescription. Medications are only sold at pharmacies. You'll have to pay a small fee for each prescription. Getting a prescription renewed requires going to see your physician. Birth control pills, for example, aren't paid for by insurance, with prices ranging from about 10 to 25 euros per month. And pharmacies usually aren't open 24/7, as well as having reduced hours on Saturday and are closed on Sundays. Some stay open overnight based on a rotation schedule, which you can find online.
Calling in sick to work is also something you'll need to know how to do if you're not feeling well. Remember to always see a doctor when you're sick and to get a doctor's note to give your school when you call in sick. Mental health resources are also valuable to know about in case you need them. If you find yourself needing access to mental health services in Austria, you're required to find a provider yourself. Information on getting psychological help can be found on Fulbright Unterrichten and in the handbook. Lastly, check out the healthcare section of the handbook for extra links that might help you along the way.